Good evening, everybody. It is Wednesday evening, 8 p.m. And tonight we are talking to Dr. Moloi from Joburg Fertility Clinic. Thank you for joining us. I see Dr. Moloi, I see you here. We're just going to wait about 2 minutes for everyone to join us and see quite a few people joining. Hi, Henrietta. Hi, Leto Gonale. Yeah. Doctor, I'm going to accept in just 2 minutes. So tonight is how to prepare for a successful IVF. For those of you who are doing IVF or are preparing to do IVF, thinking about doing IVF, obviously, IVF is a very expensive treatment. And if you're going to do it, I definitely suggest you join us, listen to what Dr. Moloi has to say. He's a fertility specialist at Joburg Fertility Clinic. So I'm just going to accept him and then just hope that everyone just joins us. Here we go. Rahya, Zad, Shiham. And I'm just going to say hi to everyone. I have just accepted Dr. Moloi. And there we go. Good evening, Dr. Moloi.
Good evening, Leanne. How are you?
I'm fine. And yourself?
No, I'm okay.
That's great. Thank you. Thank you for joining us this evening. We're just giving everybody, everyone's getting the notifications. I can see our numbers going up and everyone's joining us. And so hi, Ayoy and Urban Gentle Brother. Thanks for joining us. Again, we are talking to Dr. Moloi. He's a fertility specialist at Joburg Fertility Clinic. And tonight we are talking about preparing for a successful IVF. And obviously, like I was saying, that IVF is very expensive. So, it's best to actually prepare for it, taking the right supplements, doing the right thing. And I'm sure you've got such a lot to tell us about it and what to do, what not to do. So thank you again for taking your time out, because I know fertility specialists are very, very busy. You guys have full books. So I'm going to hand it over to you and listen to what you've got to say. First tell us a bit more about you and where your practice is situated, things like that. And then please tell us about, preparing for successful IVF.
Yeah, good evening, Leanne, and good evening, family. Really, it's a pleasure for me to really come and present this, and it's a very, very important topic. I'm Dr. Jabulani Moloi. I'm a fertility expert and an endoscopic surgeon from Johannesburg Fertility Center. We call it usually Joburg Fertility Center. We are in Sunset Square in 4 Ways in Sandton in Johannesburg. Now, we actually do two things in our center, which we're proud of. We do reproductive medicine, which probably comes to IVF, IUI, and ICSI. And then we do also endoscopic surgery, conservative surgery, where we do tubal anastomosis. We do laparoscopic myomectomy. We do treatment of endometriosis, cysts, and laparoscopic ectopic. Those are conservative surgeries which are helping, our client to get to pregnancy in most of the cases. Now, our topic today actually says that how can we, or how can I really prepare myself to have a successful IVF treatment based on actually two reasons. The first one I would say you have already talked about, which is very important, the emotional aspect, emotional challenge which our patients are going through. This is not an easy task they go through. It's got all other influence and all other challenges which they come with, which we need to identify. It's very emotional indeed. The second important thing is the physical, impact of the whole process, which, the patient will go through. But today we're going to try to make sure that the patient really feel it easy and the patient can enjoy the journey. As a family of fertility solution and Joburg Fertility Center, I think we are there for the patient. We understand those aspects as well. Now, what is the paramount important is that the patient need a thorough workup, or what we call physical examination and a good history taking. That's the basics, so that really the problem or the challenges are identified and probably written down. By that, by seen by a fertility specialist We'll go through all the medication the patient is seeing or is having, all the comorbidity, all the conditions which may have an impact on the outcome of this IVF treatment. And the second important thing I would say, which we probably need to go through, it's doing some couple of tests, which, after, which are indicated. The first test is really to check for ovarian function and make sure that, she still have a number of eggs which you can use. And that could impact as well on the protocol, the treatment which you can use. We are, here in Joburg Fertility, we really try to individualize patients. Patients are really not the same. You cannot give the same treatment for everybody. Therefore, you have to really individualize so that the outcome can be better. The other important thing we do, semen analysis in a male partner. That help us to understand the situation. We're getting a lot of other problems as well from the male partner, and that maybe we look at the semen, look at the volume of the semen, looking at the concentration, look at the morbidity, and so forth. And the last important thing which we need to do is what we call a gynecological scan. We're dealing with the reproductive organ. We need to look at the uterus, where the baby is going to grow, look at the inside of the womb, it's okay, and so forth. And then look whether there's no fibroids, and look there's the tubes are okay, or there's any problem with the tubes. These are the basic things which we need to do. Now, there are, to patients, I'll say there are soft things which we can do, or, the low-hanging fruits which you can quickly pick up, and the patient can make sure that, going through this journey, at least on her side, she has actually taken a part and done most of the things. The most important one is this one, actually smoking. Smoking really needs to be, quitted at all costs. It's very expensive process, and then emotionally, as I said, and physically really demanding. Then if you reduce smoking or stop altogether, you increase your chances of fertility. We know that smoking reduces fertility. We know that smoking affects the egg quality. We know that smoking as well affects the sperm quality. Therefore, that should be reduced, and even success rate of IVF. Then the second one is alcohol as well. Alcohol should be reduced at all costs. Alcohol is associated with a lot of others in poor outcome in IVF fertility. Alcohol also reduces the chances that pregnancy may happen. Even if you are pregnant, that baby is also vulnerable to something like fetal alcohol syndrome. Therefore, we really encourage those two things, which we really ask our family at all costs, not being judgmental, but help them to really, just change those habits quickly, and so that we can start with the treatment. The other important, which may be very dicey and actually very difficult, but for some patients we really encourage. Some patients come with a weight problem. We really encourage them to reduce weight as much as possible. We know that weight do have an impact on IVF outcome. We know that even if you're pregnant, you are vulnerable, or there's high chance that you may have even miscarriage. We know that if there's a risk of anesthesia, sometimes you need to go to do the pickup, and then you go through under anesthesia, which can give you complication. Obesity or weight as well associated with the preeclampsia and preterm labor. Those are the things you can look at. Now, other things, nutrition as well. Really, our family and so forth who are aspiring to go in that level, they should look at the diet, nutrition. In that, we don't say go and buy very, very expensive food there. The cheap food, vegetables, fresh fruits really will go a long way. Poultry, fish are most important, grains and all that. This should be actually the diet which we encourage everybody, not some people who are only going for fertility. That is have a good impact, and it helps patients in general. Supplementation, yes, is very important as well. Prenatal, you can get over-the-counter supplementation, but the basic thing we're looking at is folic acid, which is very important, vitamin C and vitamin D as well. Folic acid is much important for quality of the sperm DNA, and also it is important as well for the quality of the egg as well. Then looking at other things during this, when we look at this patient as well, we also go through to some of the other things. Let's say medication. over-the-counter medication. We try to see reduce that as much as possible. Aspirin, Brufen, and all that. Sleeping tablets, all those kind of things have an impact on fertility, and it's most of research have proven that. Then the other medication which you need to discuss with your patient, with other patient may come for. Remember, there's emotional element as well there. Patient may come with anxiety. They've been on anti-anxiety. They come with depression. All those things we take into cognizance, and we try to help patient so that we can reduce those which actually can be harmful during the process of IV treatment. Then the other things, exercise, physical exercise. If really we don't say go and run, a Comrade marathon. No, it's not necessary. You need to really exercise. Running 3-4 blocks down this. Be active. That increase the blood flow to the pelvis. Increase the blood flow to your ovaries. That increase when you start the treatment, get more eggs. It's been proven. That's research have proven that. Swimming, jogging, yoga or something like that. All those are very, very helpful. Now, the other important thing is the mental state of the patient. That discuss with your doctor when you start the treatment. When you feel you're too anxious, when you feel depressed, then a psychologist can come in to help you through on that, which we have one in the house also to help our patient. In general, I think as Joburg Fertility, we do understand our patient. Our patients come from families. The families have extended families. They've got uncles, fathers, and so on, who actually can put a lot of pressure on them. That we try to reduce it. Some come already lost hope. Some come already been labeled, judged, and all that we need to deal with it. I know that, but it should be, that they should feel being family and express that to us so that we can try to, help them through that. I think is what I can say to you. Anything, anything you think?
Just want
Yes.
No, I'm just thinking it's the very first time I've actually heard when I'm speaking to a fertility specialist and they're actually bringing about that side of it and you're actually understanding. I mean, I've had so many times where patient says, please don't send me to that doctor. Can you recommend another doctor? Because I've been to this doctor, but this doctor was so rude to me, or I don't want to say rude or without offending anybody, but the doctor doesn't understand what they're feeling, emotion and stuff. And it's the first time I'm actually hearing from a doctor that you understanding what they are going through and where they're coming from. When they get to you, it's almost like you are their last hope. And they put all that hope in you. So you're actually understanding the pressure that they're getting from outside, from extended families and uncles and fathers and things like that. So thank you for that, and thank you for being there for the women in that sense also, and understanding that it's an absolutely an emotional journey that they're going through. It's not just something like, okay, let's just do an IVF. It's literally their last step. Like, this is what we're putting our hope into, and you understanding that. So thank you for doing that, doctor. Thank you so much.
Okay, thank you, Leah.
Yeah.
Yes.
You can go ahead, doctor.
Yes, yeah, I'm saying yes, that is true, that we should really identify as well. Then the other thing which we also have to identify, women also come because of also some cultural traditional whereby the issue of not getting pregnant is being assigned to them all the time. It's really very difficult for them. They actually, which I don't believe in any case, that you have to be in a sort of a family or you have to prove yourself. We believe that the process of having a child in a family is the responsibility of both the husband and the wife. If they are the same sex, both of them, they should take accountability. It shouldn't be a blaming, a situation whereby you are the one who can't do it. Therefore, that also I see patients actually, if they got a strong support from the partner, they become stronger. And probably that increase the success rate as well, because they feel very strong and they feel positive, and the outcome become positive as well.
Wow. Thanks, Doctor. I'm getting questions here from Gertrude.
Yeah.
Yeah, I'm getting a few questions. Gertrude is asking, obviously, does it cover a medical aid cover it? So we all know that there is one plan, Discovery, that covers part of it. I would suggest you contacting Dr. Moloi directly. He's on our website, or you can just contact Joburg Fertility Clinic, and you can find them, or you can just contact them through the Instagram page as well. I will put up the details later, and it will be on our Instagram page as well. You can contact Dr. Moloi directly, and he can discuss everything with you. So yes, Urban Gentleman is saying yes, it does cover the cost, can run around 75K. With Urban Gentleman is, thank you for that. Is there anything else that you would like to say, Doctor?
Yes, I would like to say as well, these patients we share, or this family which is going through, that is true. There's a physical, the emotional element. It's very
Yeah.
important that we also address it fully, because emotions really sometimes patient may take decision which are not okay. And I that is true. I said quit smoking, quit alcohol, but some of my patients will say just a glass of wine. They say, you know what,
Mm.
that is, I know, understand what you're trying to say. You're trying to say to me, you're so stressed, you really need something. But really to exercise, to have something on the side, to exercise, to really try to get yourself to rest as much as possible, and then have the partner also around. It really relieve a lot of pressure to those kind of couple. And then I would really appreciate that we as men as well, we should really be involved in this situation. Actually, we should be supporting our partner. Now, the other thing is the treatment which we give for IVF, for to get pregnant. It can give a lot of side effects. It can make men to feel that I'm getting somebody who's irritating me. They should understand sometimes it may be side effects, and they should really support their partners knowing that. But we do, Joburg Fertility, give them medication and say this medication may give you can be irritable, can be short-tempered, you can, have hot flashes, you can have that. Please bear with her and just support her through this until, everything is okay.
Wow. Okay, we're getting more questions here, Doc. So let me just go back to them and ask them. So, Norem is asking how long you have to be staying in Johannesburg for IVF treatment if you're a foreigner. You can still go, and doesn't matter if you're a foreigner, you can still go and see Dr. Moloi. There is no, you don't have to be like a South African citizen. I think Doctor sees quite a lot of people from foreign countries that come over to South Africa to actually have the treatment. So please go and see Dr. Moloi. And then there's a question: is there any treatment that can help with egg quality or increase your AMH? Is that something that you can answer?
Yes, basically, I've answered that question. The most important thing to really increase your chances or the quality of the eggs is quitting certain habits. The first one is really smoking and if alcohol. And the third one is really looking at your weight. Is very important. The third important thing as well is to looking at nutrition. We do give a lot of patients some supplements. A lot of supplement increase the quality of eggs and increase the motility of the sperm. And then even with those
Oh,
who
sorry,
have a
Doctor,
low sperm count, sorry, who have a low sperm count, we do put them on certain medication with improve that. But generally, most of the thing, exercise, good rest, quit smoking and alcohol will definitely increase, and increase actually a good nutrition will improve the quality of the eggs before you start
okay.
your IVF treatment.
So everyone's asking, they're obviously asking that question, and I think you've actually answered it in the very beginning where you are saying that every individual is different. Every person that walks through the door, every patient walks through the door, it's completely different. It depends on what their results come back with, and then you would obviously prescribe the medication that they need to be on for their treatment. So, it's no use actually saying, go out and get this medication, go buy something over the counter, and that's going to increase your chances. I would definitely suggest everyone, and as far as according to Dr. Moloi, is every patient is different, the individual. Go and see your specialist, and he can then, according to what it is your results come back, he can then tell you what it is that you need or you're going to need. I just want to see if there's any other questions for Dr. Moloi. This has been very, very interesting. Okay. From work, please answer how long treatment is as a foreigner. Norma, I think you'd need to definitely go see Dr. Moloi. Contact him. You can just send him a DM on Instagram, and he will definitely be able to assist you with that, because I think it depends on what it is that is required. So thank you again, Dr. Moloi. Again, thank Dr. Moloi is from Johannesburg or Joburg Fertility Clinic. You can find them on Instagram, Facebook. They are on the internet. If you just search for them, they're also on our website, fertilitysolutions.co.za. You'll see I do quite a lot of posts for them. And yeah, thank you again. We're looking forward to your next talk, which is at the end of the month. And yeah, thank you so much for inspiring us and telling us what to do when it comes to having a successful IVF. You ladies have heard, eat healthy, exercise, quit the smoking, quit the drinking, ladies, and definitely would increase your chances of a successful IVF. So thank you again, doctor, and have a great evening.
Thank you. Thank you, family. Bye-bye.
Bye.